Hello, my name is Dr. Alfredo Lucendo, gastroenterologist from General Hospital of Tomelloso in Spain. Today I will answer the questions: what does an elimination diet in eosinophilic esophagitis, when it is useful, and how long a patient have to stay on an elimination diet to treat eosinophilic esophagitis. Well, eosinophilic esophagitis is a chronic esophageal disorder caused by a local immune reaction to food components. Therefore, EoE can be considered as a particular form of food allergy. It is important to say that a small number of foods, usually one or two, will be causing eosinophilic esophagitis in the majority of patients. However, identifying the exact food or foods involved in EoE in each particular patient has been a matter of intense research because, unfortunately, allergy testing based on blood analysis or a skin test is unable to identify accurately the food or foods that are causing EoE in a particular patient. We usually recommend empiric food elimination diets to patients based on excluding those foods more likely related with allergy, including milk, egg, nuts, legumes, or wheat without performing allergy tests. The greater the number of foods is excluded, the more effective a diet is to induce EoE remission. We must say here that any diet in EoE, independently of the number of foods that are removed, should be followed by endoscopy with esophageal biopsies after an initial typical 6-week period to check if eosinophilic inflammation has vanished after the diet. At this point, it is very important to remark that food removal is only the way of achieving a normalization of the esophageal mucosa as the starting point to identify exactly the food or foods that are causing EoE in a particular individual by sequential reintroduction of the previously excluded foods, one after the other, challenging the esophageal mucosa and using repeated endoscopy with biopsies to check if eosinophilic inflammation reappears after challenging with the specific foods. Regarding the second point, when dietary therapy is useful for EoE, I could say that dietary therapy is the only drug-free therapy able to target the exact cause of EoE. The main foods involved in triggering and maintaining EoE are milk, wheat, or gluten, and eggs, which are foods widely distributed in a staple diet in westernized countries. So adherence to dietary therapy represents a challenge for both patients and families. We recommend this treatment option for patients highly motivated in finding out the cause of the disease who wills to maintain EoE control long term with no need of drugs. And finally, patients on dietary therapy should stay long term on a diet by avoiding exclusively the food or foods that cause EoE in the particular case, which mostly consist in one or two foods, typically milk, eggs, or wheat, as said before. Disease recurrence will be observed as soon as a patient abandons the diet. If you would like to know more about this topic, please consult your doctor or visit our website. Take care.